And although she's an obstetrics and gynecology specialist, she has been drafted in to help with the COVID emergency. Thank you very much for coming on the program, Dr. Malta. Give us some idea of how bad the situation is in Manaus.
Thank you for having me. Well, we were already facing some difficulties because we don't have enough hospital beds or ICU beds for all the patients that were coming in. And suddenly, after the last week of December, there was an explosion of critical cases. So we were prepared to deal with this surge. And yesterday, we received the news from colleagues on WhatsApp that we didn't have enough oxygen for all the patients, and we were required to be there to manually to manually offer oxygen to patients. So
right.
When the other colleague was tired, we had to assume.
And to what extent are these new infections in Manaus down to the new variant of the virus?
Probably yes, because we were having some months of relatively calmness. And suddenly in December, it all started to pop up and to increase in alarming levels, especially in critical cases, more critical cases, more young people with severe damage also.
Of course, the world looked to Manaus, which I think had a 70% infection rate early in the year, and thought that you might be one of the first places on the planet to get some kind of herd immunity. But that doesn't seem to have happened.
Well, as it does happen to all viruses, they mutate, they evolve. And we were hoping that it had evolved to a less damaging virus. But it was the contrary. It evolved to a more damaging, more infectious type of virus. And we are facing the consequences of the choices we made to continue on the streets, to continue our lives as if we were in a pandemic, you know.
Dr. Malta, thank you very much indeed for your time and best of luck.
Thank you for having me, and good evening to you all.
Well, I'm joined now by Dr. Margaret Harris from the World Health